Hi, I'm Jeff with Wave Tools. We're going to talk about carpal tunnel syndrome today and how you can use your wave tool to help treat that. And we'll also show you some stretches that you can do. We have some really nice anatomy slides along with this post that show you where the median nerve comes out of the neck through the thoracic outlet, into the forearm, and then through the carpal tunnel. The carpal tunnel is a real thick band of retinacular tissue across the top of the carpal bones here. So we have the median nerve running through that tunnel, and then a lot of our finger flexor tendons also run through the tunnel. So if you're using your forearm a lot, if you're using these flexors a lot, you can get tightness in the muscle, you can get swelling and inflammation of the flexor tendons, and that swelling will increase pressure within the carpal tunnel and squeeze the median nerve. The median nerve goes to your thumb, your first, and your middle fingers, so that's where you'll tend to feel the symptoms if you do have compression of the nerve. Okay, let's use our wave tool to help treat some carpal tunnel symptoms. I have a little bit of lotion I already put on my arm, so put whatever lotion that you have handy on there. Hold your wave tool up so that this disc is facing up, and then just grab the top of the disc. Now we can use the blade edge. So first, just start by pulling up towards your body, just like you're plowing snow. So plow that lotion up and along the forearm flexors. You don't need to push very hard. So lots of strokes just up and along the muscle. If you find areas where it's a little crunchy or where it's a little sensitive, then you can work those areas a little bit more and help break down any myofascial restrictions. So just lots of strokes up and along the muscle. This will help decrease any swelling and inflammation and pull it up and flush it out of there. It'll break down myofascial restrictions and it'll decrease pain and help these muscles work more. Now that we've worked on the forearm flexors themselves, let's go ahead and get into the carpal tunnel a little bit more. So the same grip position, just grab the top of that disc so we can use the blade. Now we want to get right into the carpal tunnel here, right? The big meaty part of your thumb and the little meaty part of your little finger, the carpal tunnel's right in between there. So hold the blade right up in between there. Now you want to scoop the blade out to the side and catch on that little pisiform bone there along the pinky and just push out against that and help spread that carpal tunnel. It actually feels pretty good. Now do the same thing, scooping up towards the thumb side. It'll feel real crunchy in this carpal tunnel, that's okay. And just scoop up and laterally up against these thumb muscles. So back and forth to help spread that carpal. Now that we've worked on the carpal tunnel itself, and you want to do quite a bit of that, it'd be a good idea to work on all the finger flexor tendons themselves. Again, we're worried about the flexor muscle here and the tendons going into your fingers. So hold the tool so that the little notch is up, or do what we call a pistol grip. And now you can run that little notch, just run your finger tendons all along and through there. So if you have any areas of restriction or soreness or swelling within those flexor tendons, you can help smooth that out, break that out. For rock climbers, this is a nice thing to do anyway, just to keep your tendons and your pulleys healthy. So spend a whole bunch of time working on each of those fingers. Now let's do some trigger point and massage work on the forearm muscles themselves. So hold the tool upside down with that disc facing down and grab it in what we call that pistol grip again. And now we can use this trigger point knob. So just press into the forearm muscles, find a tight trigger point area, and you can do deep pressure with that trigger point knob into that sore spot. And another good way to do it is to put pressure and then stretch the wrist down and back. You can do the same thing. It's a little gentler with the pressure disc. So massage along, and if you find a tight, tender area, you can massage it, or you can press and extend with your wrist. And then also use this nice little saddle area in between and just do lots of massaging strokes back and forth along the muscle. And that feels really nice. Okay, after all of the wave tool work, let's do a little bit of stretching. Let's first stretch the forearm flexors. You want to hold your palm up, elbow fully straight. Grab it with the other hand and pull your fingers down. So again, elbow needs to be straight, pulling the wrist down and back. That should give you a full stretch of those forearm flexors. You want to hold it for quite a long time, up to 30 seconds. If you need a more aggressive stretch than this, Then you can get down on hands and knees position and put your palms on the floor, and then you can use your body weight to rock back and forth to stretch it that way. Also, we want to stretch the front of the shoulder. So up in a 90-90 position, you can put your forearm against a door and lean into it. You want to lift your sternum up and out, stretch that whole pec area. You could also lie on a foam roller and let your arms drop back against the floor and fully stretch this anterior.